Top medical experts in China have been deployed to the Chinese city of Wuhan and surrounding cities affected by the coronavirus outbreak in the latest efforts to curb the spread of that virus. So far, 106 people have been confirmed dead by the Chinese authorities, whilst more than 4,500 people have also been infected.
我心里还是有点拒绝的，还是怕啊，主要是很怕，但是很快就接受了，因为他们从我们就刚结婚的时候就参与非典的这个救助，包括后来的这个汶川地震，玉树地震，从来没有停下来过。就是洗漱包很简单，可能穿了防护之后。
不了解的时候就会觉得很神秘、很恐怖，但现在已经知道是什么病毒，它传播途径是什么，怎么传播，然后呢，整个临床什么特征，然后是怎么去救助，所以这样的话，我们就心里也就有数了，然后慢慢的，我们通过这样的沟通交流，他也就慢慢就放心了。
我们支持你的武汉去抗击这个病毒，支持保护你的防护。
Well, that's a summary of the problem that the whole world is having to deal with now, of course, originating from China. We'll bring you more details on this particular story, plus an appeal by Ghana's mission in China for Ghanaians there to remain calm because efforts are being made to address the problem. Also, we brought you what the outlook is like from China. Well, a while ago, Ghana's deputy head of mission in China, Dr. Charles Jamna, made an appeal to Ghanaians who are locked up in that town in Wuhan to remain calm. He's been talking to us.
At the moment, the most important thing is for people to remain calm. You see, the point of the matter is that all the leading experts on viral outbreaks are currently in China from all over the world. The WHO has assembled all of them in China. So, assuming that you even get infected, your best chance of survival is here in China. This is where the trial lessons are taking place. This is where the experts are currently and trying their best to save lives and all that. But if you go outside this zone, it becomes difficult. Get to Ghana, for instance, with the virus. It's more or less signing a death warrant to the Ghana Health Service, but because it's a new outbreak, there is no known cure, no vaccine. So whatever is being done progressively on this issue, it's being done in China. So when you leave this zone, it's a difficult situation to put yourself in. So we are advising people remain calm, stay indoors. That in itself will reduce it by a large percentage your chance of getting infected. And then observe the necessary precautionary measures. And by and large, it's a phase. We'll go over this phase. Once we go over the phase, and life will return back to normal.
He's a deputy head of Ghana's mission in China. This afternoon, we have a statement from the Foreign Affairs Ministry here in Ghana, buttressing what the mission is saying. And I read to you what that statement says. It says, novel coronavirus in China. The Ministry of Foreign Affairs and Regional Integration wishes to assure all parents, relatives, and friends of Ghanaians in China that the Embassy of Ghana in Beijing and the Consulate General in Guangzhou are in contact with leadership of the Ghanaian community and the National Union of Ghana Students, China, and receive frequent briefing from them on the welfare of all Ghanaian nationals. The mission has advised all Ghanaians to stay indoors and adhere to preventive precautions outlined by Chinese authorities. In the next paragraph, it says, currently, no Ghanaian has contracted the novel coronavirus, even though we have about 152 students in Wuhan, where the virus was first reported. Again, the embassy is in contact with the students and is liaising with their leadership, the Wuhan Foreign Office and the universities to ensure the continued safety of our students and the provision of basic necessities. The ministry and our mission in Beijing are currently engaging with relevant authorities in both Ghana and China on various possibilities for the safety of all Ghanaian nationals, and the general public will be updated subsequently. The underlisted measures should be observed by all Ghanaians that intend to travel to China during this period. And it goes on to mention the things that you need to do. First of all, it says to buy medical insurance. So if you're traveling to China, do not go without an insurance. Number two, it says to acquaint yourselves with the nearest medical facility where they treat high fevers and also speak English, or have a translator who can help in case of an emergency. Well, these are the things that you need to do if you're traveling there. Number three, the statement says anyone visiting Wuhan would be subject to a mandatory 14-day quarantine before leaving the province. So these are three key things that you need to do. If you need to travel to China, first of all, you need to get a medical insurance. Secondly, you need to ensure that where your destination is close to a space where they treat people for high fevers and where there is a translator at least, or where someone speaks English. And the third one is for you to know that if you're going especially to Wuhan, you'll be subjected to 14 days of quarantine before you can leave the province. Now, it goes on to say in the last but one paragraph, that most universities in China have postponed their reopening dates indefinitely. Parents, guardians with wards, particularly in Wuhan and its environs in the Hubei province, are advised to immediately contact Ghana's consular hotline on phone numbers +861 861 2084 23032. I'll go through that again. It's 861 861 120 84232, or +861 861 295 9040. That's 861 861 295 9040. The Ministry of Foreign Affairs and Regional Integration remains resolute on working with the various Ghanaian communities and the students in China to ensure that they are provided with the needed consular services within their remit. So that's the statement coming this afternoon, actually just less than an hour ago, released by the Ministry of Foreign Affairs there on what you need to do, what you need to know if you have anybody in China or in Wuhan. For the Health Ministry, it says it is working with the Ghana Health Service, and it has introduced measures that are aimed at preventing the spread of this disease into Ghana. Well, that's the second statement there for you. It says an update on Ghana's preparedness on the novel coronavirus infection, and this is coming from the Ministry of Health. The previous one we read is from the Ministry of Foreign Affairs. This Ministry of Health statement says the Ministry of Health has, since the recent outbreak of the novel coronavirus infection in China, initiated steps to prevent and control any case that may be detected in Ghana. The preparedness and response have been focused on specific thematic areas to ensure that the Ghanaian population is protected. Subsequent to the earlier release on the 2019 Corona NCOV on the 21st January 2020, the MOH has triggered the National Emergency Preparedness and Response Plan based on the following thematic areas. Now, I'll go through those thematic areas for you. First of all, it talks about coordination. As part of the coordination, the National Technical Coordination Committee meeting is constituted by experts from the Ministry of Health, Ghana Health Service, the World Health Organization, Veterinary Services Department, the Noguchi Memorial Institute of Medical Research, the Centers for Disease Control and Prevention, among others. That meeting, we're told, was scheduled for the 23rd of January 2020, and regular meetings are scheduled to update and review national response. Part of the coordination plan is an activation of regional and district Public Health Emergency Management Committee. This, the Ministry of Health says, is constituted by regional and district level leadership of all sectors, including local government, security services, health and other key partners. Alerts have been sent to all of these across the regions and the districts. The second part of that emergency plan that the Health Ministry has triggered is surveillance. And it goes on to say that they've developed case definition. Now, what that means is that a case definition has been developed to help clinicians detect potential cases and manage them appropriately. They've sent alerts to regions and teaching hospitals. Alerts that have been sent to all these regions and teaching hospitals include the points of entries on the outbreak. The alert also details clinical features of the infection and give guidance on how to prevent it. Well, sensitization of healthcare workers is also a part of the plans the Health Ministry says it's embarking on. It says that ongoing sensitization of healthcare staff, especially at the points of entry and the designated treatment centers, are ongoing. Large-scale sensitization and training of healthcare workers are also planned. And the fourth part of that says active surveillance is ongoing. The development of case definition and the issuance of alerts are part of measures instituted to ensure active surveillance at the various health facilities and points of entry. Now, regarding the points of entry, there's also a detailed plan for that. And the first point is an enhanced screening, including the use of health declaration forms. An existing health declaration form has been modified to suit the current outbreak. And if you have been a part of that, let us know what your experience has been. But the statement goes on to say that the administration of the health declaration form started on Friday, 24th of January 2020, and was restricted initially to airlines with connection to China. Currently, the declaration form is applied to all international arrivals at Terminal 3 of the Kotoka International Airport. They say that screening for fever using the walk-through thermometers and non-contact thermometers are also ongoing at the Kotoka International Airport and other points of entry. They go on to say that efforts are underway to ensure that all Ghana's points of entries have non-contact thermometers. On the fourth point, to talk about what is being done as far as laboratory work is concerned. They say that logistics for diagnosis are ongoing. Their contact, they say, at Noguchi Memorial Institute for Medical Research has indicated that they have capacity to diagnose the coronavirus infection, and the ministry says they have designated the Noguchi Memorial Institute laboratory for the coronavirus investigation. Finally, on that fifth point is how to manage the cases that may occur. They say that Ridge Hospital and the Tema General Hospitals have been designated as initial case management centers. So just so you know, Ridge Hospital and the Tema General Hospitals have been designated as initial case management centers, and the regional authorities are on this. Well, quickly, the Health Minister Kwajima Menu says the healthcare delivery will be boosted in regards to this. This is a statement also coming from GUTA, Ghana Union of Traders Association. It wishes to advise members of the business community, especially traders who intend or are preparing to travel to China for business or any other thing, to hold on and, if possible, do their business related and other communications on the internet until the case of the outbreak and the spread of the disease reported in the media is brought under complete control. He goes on to say that for those who have recently returned or are returning from a trip to China and its environs, they should carefully observe themselves and report to the nearest health facility immediately they start feeling any symptoms of the disease, as stated by health officials, so that they can be early diagnosed and treated. The statement goes on to say that we urge everybody to listen and comply with the directive issued by health authorities in the country. It is our prayer that no trader is affected by the virus. That's the statement coming from the Ghana Traders Union Association. Looks like an afternoon of statements, but of course this is a steadily spreading disease and we ought to all be careful.